This is an SABC News presentation.
Hello, sanibonani babukeli, siyanamukela kulolu hlelo lwethu Yilungelo Lakho, it's your right. Welcome to our new look, new studio. Well, it's coming to you live from SABC 1 Mzansi for sure. Kanti ke ligama lami nginguJonathan Lungu. Sitawuqhubeka nalo luhlelo njengenjwayelo. Sivule incingo tethu ukuthi nawe lapho ekhaya uvakalise luvo lwakho. Kanti inombolo tethu tase studio tithi 0117146918 noma 7146919. Ungathumela i-SMS ngokuthi uthumele igama lelithi right ku 33726 noma uthumele i-email ku consumer@sabc.co.za. Alternatively ungasivakashela ku Facebook page yethu ithi Yilungelo Lakho noma uthumele i-tweet ku @yilungelo. Diabetes is said to be a silent killer. Many of its victims do not even know that they have it until it's too late. More than 5 million South Africans are suffering from diabetes. This chronic condition can be dealt with or even reversed only if people tested early or adhere to healthy lifestyle and as well as good diet.
Inqali sinoloyiko lokuba isifo seswekile okanye diabetes singabangela ubhubhane ukogqitha nkqu nesifo esingugawulayo i-HIV AIDS. Isizathu kukuba uninzi alwazi ukuba lugula luhamba. Ogqirha apha i-Centers for Diabetes and Endocrinology bathi baphakathi kwezigidi ezine ukuya kwezithandathu abemi belilo Mzantsi Afrika abambombozelayo iswekile. Elizike lapha eHoughton liyinxalenye yamaziko angama-270 phantse kulo lonke eli. Ubuncinane ogqirha baxilonga izigulane ezingama-40 ngosuku. Le meko yeswekile kulapho kanye ingacolekiyo kakuhle iswekile efumaneka emzimbeni ngendlela yesiqhelo okanye i-use of glucose normally. Nanzi impawu zomuntu oneswekile: ukuchama qhoqhoqho, ukuhla komzimba ngendlela eyodwa, ukubona luzizo okanye ukufiphala, izilonda okanye imigruzukwana epholakade, ukosuleleka okungenasiqabo. Le ngulo ayinaluhlanga, ayinasini, ayinamntu utheni, nokuba ngubani unokuba lixhoba. Ukanti ichaphazela indlela yokuphila, ukuzivocavoca ngokwemithambo nendlela umuntu atya ngayo, ukutya iziqhamo nokuzilolonga ngokomzimba into enconywe kakhulu ngogqirha.
It should not stand in the way of you achieving whatever you would like to achieve in life. It's really coming to terms with that, and that's where some in-depth counselling may be needed, but we have many examples of patients who live successfully with the condition.
UGraham Biddle wazibona ukuba ukulemeko kwisithuba seminyaka engama-25 egqithileyo. Kodwa wayenyenzelekile ukuba athobe isantya kwizidlo ezifana nechocolate, utywala, iziselo ezihlwahlo zayo. Kodwa uhlala athi laqa oku komntwana. Kodwa uthi ubulumko bobokuba undwendwela ugqirha okanye ugqirha wamachiza wenze novavanyo gazi.
There are millions of people who don't know they have the diabetic condition. There are millions of people that are undiagnosed, and it's only when they have an accident or admitted to hospital that tests show that they in fact have diabetes. So this is one of the biggest problems, is to get people diagnosed as diabetic. And a visit to a doctor, a visit to a chemist, a visit to a hospital will give that information by a simple blood test.
Ingqali sikwathi xa ufunyene unalengulo qiniseka ukuba utyelela ugqirha utya ukutya okufanelekileyo, uyazilolonga, wazi okokuba awuyonzalelwane enembali yale ngulo kusini na.
Abantu abane-history strong efamilini kubalulekile ukuthi bona kanye enyangeni ezizintandathu bake bandwendwele ikliniki bachekishwe ishukela le kuthiwa yi-fasting kusho ukuthi batheste bangakatyi ukutya okwasekuseni ngoku kuzaqinisekisa into yoba bona umuntu uzawuyazi ngaloo ndlela ukuthi unayo i-diabetes noma akanayo.
Eli ziko likwathe le ngulo ingxamele ukwanda kangangokuba kuyakuthi kubetha u-2015 babe abantu abalinganiselwa kwizigidi ezine bepenapena yile ngulo. Themba Makeleni, Yilungelo Lakho, eGauteng.
Thanks, Themba, for that introductory story. Ganziloyo bekungithemba Makeleni, our producer. Kwenye lo saqhubeka nenkulumo yethu ngaso lesifo se-diabetes ngelwimi lethu lesilitayele kuthiwa sifo sashukela. Sithanda kwamukela tivakashi tethu, samukela Dr. Sandip Broda. Welcome, doctor.
Thank you.
Ganzi yena u-specialist esifo sashukela. Siphinze samukele Graham Biddle, yena lo phila nesifo se-diabetes yelihlobo lwe-type B. Welcome, Graham.
Thank you.
Kanti lomunye lesinayo Isaac Solani lo i-trainer noma umceceshi ku-Center of Diabetes and Endocrinology. Welcome, gentlemen, here on our show. It's your right, Yilungelo Lakho. Some will just ask or wonder why we're talking diabetes. Why don't we talk about cash, deaths? But let me start with you, doctor. Diabetes, is it serious in South Africa? Is it something that we can take it serious as citizens?
Well, diabetes is a very serious condition. It's a very common condition worldwide, and it's increasing in South Africa. To date, conservative figures will show that about 6.5% of the South African population have diabetes, but true figures may be as close as 13%. All right, and you overlap that with the impact of things like HIV, tuberculosis. You're dealing with a major health epidemic in Southern Africa. So yes, it is a very important epidemic. It needs a lot of attention, but it's a type of disease that requires a multidisciplinary kind of approach to dealing with it, from the healthcare side, from the government side, and from the patient side as well.
Okay, let's just look at its origin before I come to you, Graham. Its origin, where is it originating from?
And when we use the word diabetes, it's a broad term. There are two types of diabetes, really, just to keep it simple for the sake of this discussion. The type 1 diabetic is a patient who develops diabetes early in life due to some insult to the pancreas. And this is about 5% of diabetics, and they'll develop symptoms early in life.
When you say early in life, how early?
There's a bimodal distribution, meaning that patients will either present around the age of 6 and then again at around the age of 14 on average. But they can present at any time in between two.
That's type 1?
That's type 1 diabetes, where these patients need insulin from an early age to treat high sugar levels in the blood. The predominant epidemic...
Before we go to the second point, what's insulin? What's the insulin?
All right, so insulin is the regulatory hormone for your blood sugar. All human beings eat and we digest our food to basic components. One of those components is glucose, which elevates in your blood, all right? And that glucose needs to move from your blood into your tissue to create energy so that you can function. Insulin is the hormone that allows you to distribute that sugar from the blood into the tissue. If you don't have insulin, the sugar is going to stay high in your blood. Okay,
yeah. This type 1 diabetic, is it the one that is hereditary?
It can be inheritable. It's more common. There are some genetic predispositions. It can also be acquired due to injury to the pancreas, antibodies against the pancreas. And some patients who abuse alcohol develop pancreatitis. You can develop it, and it may be associated with other hormonal problems.
Graham, let me come to you. You are living with diabetes. Just take us through the whole condition, how it, your experience, how it started, and how you are managing it now.
Thank you, Jonathan. It started some 25 years ago, where I noticed that I was urinating more frequently than usual. I had some damage to my skin, which was taking far longer to heal than I expected. And I was feeling weak at different times of the day. I went to see my GP at that time, and he, with a simple urine test, diagnosed diabetes. I was then sent for a sugar tolerance test, or a glucose tolerance test as it's now called, and that's a 3-hour procedure which confirmed that I was diabetic and had been for some time. I think one of the biggest problems we face in South Africa, that some 78% of diabetics are not diagnosed. We have a huge population here where people have diabetes but don't know it until it's picked up, usually through some other way.
Graham, you said you went to a doctor and then he simply tested the urine. Is it the only sample that they can take for testing?
No, they do a blood test as well. That's known as an HbA1c test. That's just drawing a small quantity of blood from the arm, and that's sent to a laboratory, and where it's tested, and you then get what is called an HbA1c reading. And if you can get that down, and that is not a reading of how your blood is today, but how it's been over the past 6 or 8 weeks. So there's no cheating by not eating the night before the test or the morning of. It's a 6-week history of what your blood glucose has been, and that's a very important test. But the diagnosis comes from a urine test originally, and South Africans get it very easily at a clinic, a pharmacy, a hospital, a doctor.
Okay. Isaac, you dealing with these patients every day. Gafishane nje, ungasitshela nje ukuthi umuntu lophila nalesifo se-diabetes, sifo sashukela, angakhona ukuthi asimanage njani njengoba sebaye basho Dr. Lakho?
Alright, into ebalulekileyo ukuthi abantu basekhaya funeka bayazi into yoba i-diabetes umuntu angakwazi kugula umuntu akwazi ukuphila nakho. Xa umuntu egqiba udiagnosiwa, into ebalulekileyo ukuthi na umuntu angayicontrola kanjani ushukela. So kulapho mina ndingena khona ke, ndimnikeza ingqeqesho, ndiyamfundisa akwazi ukontrola ushukela ngoba yinto ebalulekileyo.
Kumele ayicontrole kanjani? Asikhulume ke ngale nto.
I-diabetes icontrola ngendlela ezintathu. Indaba yokuqala kusho ukuthi umuntu ufuneka adle ngendlela engcono. Adle ukudla okuphekwe kakuhle, hayi ukutya okufrayishile. Indlela adla atya ngayo azilinganisela, angatyi kakhulu. Enye into ebalulekileyo umuntu ufuneka azilolonge. Ukujima noba umuntu angayobaleka okanye umuntu angahamba ngokukhawuleza. Imizuzu engaba 30 okanye 40, insuku ezingaba 4 okanye ezingaba 5 evekini. Enye into ebalulekile futhi ukuthi umuntu ufuneka athathe amapilisi wakhe ngendlela efanelekileyo.
Ngebala amapilisi uwathola emveni kokuthi sekaye ema-clinic noma sekaye kubodokotela?
Emva komuntu adiagnose ngudokotela wakhe okanye nxa egqiba udiagnose eclinic, bazamnikeza amapilisi apho okanye bazamnikeza i-prescription ukuze afumane amapilisi. Ingabe
mhlawumbe la mapilisi lapho nikade wona ahambisana nalo type 1 or type 2?
I-type 1 kaninzi wona, i-type 1 izadinga insulin. I-type 2 yiyo ke izawudinga amapilisi.
Okay, all right. Ngicabanga ukuthi sitayibeka lapho for now. Let's take an ad break, but before we do that, let me remind you that you can call us on our studio line. Our number is 011-714-6918 or 714-6919. Noma ke ungathumela i-email ku consumer@sabc.co.za. Noma usivakashele ku Facebook page yethu Yilungelo, noma uthumele i-tweet ku @Yilungelo. Please join us after this. Asiphinze sikumukele futhi mbukeli, sakhuluma yona indzaba yesifo se-diabetes, sifo sashukela. Sibuka ukuthi sibangwa yini ukuthi ngitiphi tinyathelo lekumele utithathe nangabe uhlolwe wathola ukuthi unaso. My guest, Dr. Sandip Broda, specialist kanzi lomile sinaye ngilophila naso lesifo Graham Battle, who is living with diabetes type 2. Kanti lomile sinaye Isaac Solani, a trainer at the Center for Diabetes and Endocrinology. These are the gentlemen who will help us understand the importance of going to diagnosis before you even see the symptoms of our disease. Our number is 011-714-6918 or 714-6919. Kanti ke ngembi kokuthi sivakashele ititolo, Dr. Sandip uye wavetana amaphuzu lalandzenako. Uye washo ukuthi isifo sashukela singakubamba mhlawumbe usaneminyaka lesithupha 6 kuya ku-14 years. Kanti loyo ngu-type 1, kanti sifo lesingakavamanga kakhulu leso ukuthi sibe khona. Kanti indlela longayimanage ngayo ukuthi uthole i-insulin. I-insulin ngilomjovo lobakuniketa wona ukuze ukuthi basite lingekhathi lakho ukuze likhona ukuthi ema-hormones akho akhona ukuthi abe sesimeni lesihle. Kanti bathi leyo ungayithola kubodokotela, uphindze uyithole nasemakliniki nasedibhedlela. kanti Graham lophila na diabetic type 2 yena uthi uphila nalesifo 25 years 25 years kanti Timbawu uye wabona ukuthi achithe manje isikhathi lesingapheli futhi netilonza letingapholi ngekusheshisa kanti futhi ativa abuthakathaka emtimbeni kanti ke uthi kungakuthatha from 6 to 8 weeks lokuyi history mhlambe uma bathatha umchamo mhlambe bathatha ingati yakho kanti bangahle bathathe nengati kude ba test. Let's now talk diabetes type 2. What is it?
All right, so type 2 diabetes is the predominant form of diabetes. It's the world epidemic that's affecting us all. Now, unlike type 1, where you don't have insulin, in type 2, there is initially insulin, but there's a resistance to its action. So your body is not able to use insulin effectively to lower blood sugar. And these patients usually present asymptomatically, meaning for many years there will be no symptoms. They gradually put on weight, they may have abnormal cholesterol, the blood pressure may go up. And usually by the time of diagnosis, like Graham said, it's incidental. You know, someone does a blood sugar test and it's elevated, all right? But by that time, usually these patients already have the complications of diabetes, either a heart problem, a nerve problem, a foot problem, or eye disease, or something to that effect, or kidney disease, all right? Which is why it's very important when looking at type 2 diabetes to identify risk factors. If you have a family history, if you're putting on weight, if you have high blood pressure, if you have a very sedentary lifestyle, you're not active, if you don't eat very healthy, you should go and check your blood sugar with your doctor, physician, or primary care nurse. And they should help you make the diagnosis of diabetes, which is made on a blood test. And there's specific criteria that are needed to make the diagnosis.
But doctor, looking at the condition or the situation in South Africa, you find that in some areas, like rural areas, there are few health facilities where people can go to for such assistance. Is this not maybe a contributory factor to these figures that we are seeing escalating?
Yeah, to my knowledge, and we've had the opportunity to work in some rural areas around South Africa, primary healthcare facilities are available. And the screening for diabetes is a basic test that can be done at any basic clinic, all right? All it involves is a blood test, either the finger or a formal blood test, which can be done by a nurse even. It doesn't have to be a doctor. If the finger blood test looks abnormal, then that should be confirmed with further blood tests and referral on to the appropriate people.
Okay.
But in terms of screening, it should be a basic thing that's available across South Africa.
Okay. Yeah. Let's take our first caller. Oma, welcome to Yilungelo Lakho.
Good afternoon.
Yes, ma'am.
Yes, I do have a question for you. Can I ask the doctor this?
Yes.
I've been experiencing a problem with my husband. There's someone diabetes in the family. The mother died of diabetes. But then I'm so worried. I don't know whether I should be or not. They cannot diagnose diabetes wherever you go to the doctor or to the clinic. He does have hypertension. The other thing is he's losing his eyesight. He does not have an eye problem or whatever, but he cannot see clearly, totally not. And then one other thing, he's lost his weight. He doesn't have that much of an appetite. All those things. Can I be worried maybe that he might be having diabetes that is not yet maybe discovered or what?
Okay. All right. Thank you so much, Omar. Doctor, that question was directed to you.
All right. Just help me clear up the question. She's got a family member that has some symptoms,
yes,
and there's a family history of diabetes.
Yeah.
So the symptoms she was describing in terms of the eye disease and that sort of thing may be very well in keeping with diabetes. The simple thing to do, like I said, is to have a fasting blood sugar checked. By fasting, we mean the person hasn't eaten overnight for 8 hours. Go to the doctor, check the blood sugar. If that blood sugar or glucose is above 7, then we can certainly entertain that is diabetes, all right, and that needs to be treated. However, the symptoms she described in this person could be due to other factors as well, okay? So we mustn't emphasize just diabetes. That's why you need a clinician to look at the patient and decide what are the likely possibilities, do the appropriate test, and then treat them from there. Yeah.
Okay. So, some fear that it's costly.
Yeah.
Yeah.
So the management of diabetes is a costly business. It's a huge economic burden. It affects everything from your lifestyle, the quality of your life, absenteeism from work, employment, etc. All right. However, in South Africa, in the public health sector, treatments are available. The basic drugs that are required to be used, as outlined in the South African Endocrine Society guidelines, are available in the public health sector.
Okay.
And those involve tablets, insulin, etc.
Okay, let's take a caller. We've got Zolisi from Western Cape. Welcome to Yilungelo Lakho. Zolisi, are you on the line? Ngathi Mzolisi usilahlekele ke, but kunokuthi sithathe Mzolisi awuthi sivashele labo basibhalela ku Facebook page yethu. My question is, can this disease be healed, or are we going to live with it forever? If I get tested, what difference does it make? That is Buyiswa. That's the first question. And then I think everyone at clinic, what doctor or hospital should be tested, meaning that everyone who goes to a doctor or sees a doctor must be tested for diabetes. Let's look at the first question.
All right, so at the moment, as we know it, diabetes is a chronic condition. It cannot be cured, all right? And because the cause of it is multifactorial, related to lifestyle, diet, that sort of thing, it's very difficult to manage unless we control all of those factors.
Okay, let's take another caller, Andile. Andile, welcome to our program.
Yes, sir. We got enough time. Just want to ask to the doctor, is diabetes curable or not?
Okay, thanks so much, Andile.
Thanks.
Is it curable? Thanks, Andile.
Okay, so diabetes, as I said, is not a curable disease. It's a chronic condition that has to be managed for life. And very important, the other question here was, if I get tested, what difference does it make? The importance of testing is because we said it's a silent disease. By the time you discover it, there are usually complications. So the importance of testing and knowing early is that you can manage it to prevent the big complications, which are heart attack, stroke, blindness, kidney failure, foot disease, that sort of thing.
Okay, Mzolisi is back. Mzolisi, welcome to Yilungelo Lakho.
Hello, Puti.
Yebo, Puti.
Ngicela ukubuza futhi ngaba yisokile yenziwa ukuthi ba uphunga kakhulu okanye
ukuthi uphuza kakhulu.
Ngicela ukubuza kuba uphunga kakhulu ithina okanye yenziwa intoni?
Uphunga iti. Okay, all right. Thanks so much, Mzolisi. Okay, Mzolisi, ngicela umphendule ba. Isaac.
No, ukuphunga kakhulu iti akunayo yenze diabetes. Diabetes ukuze umuntu abe nayo, at least funeka umuntu abe nofuzo. Okay, mari ukuphunga kakhulu ujamaswitsi akuyenzi diabetes.
Yeah, because there's that myth that if you eat maybe you use a lot of sugar in your tea, or you take a lot of sweetie stuffs, that causes diabetes. How can you do away with that myth?
Well, the truth is sugar eating badly does contribute to the development of diabetes, right? So when we say eating healthy and exercise, that should not start happening when you're diagnosed with diabetes. Prevention is the noblest of things here. And, people should be discouraged from eating badly long before the diagnosis of diabetes, all right? There are guidelines as to how much sugar you should eat. And if you're not sure, you should see someone, get some dietary advice, that sort of thing.
Yeah, I think when we come back from the break, we'll be talking about the diet. Briefly, Graham, the diet, or nutrition, is it expensive? Is it that expensive?
Jonathan, no. The diets need not be expensive. I think there are different diets for different people. But I know at the Center for Diabetes and Endocrinology, they have dietitians who are specialists in prescribing the right diet for the right circumstances. I have eaten a lot less over the years, and that has reduced my insulin intake over the past 25 years. And I think that it does not necessarily have to be expensive from a diet point of view.
Okay, thank you so much on that point. Asithi kubuyele dolo, please stay tuned. We'll be back. Asibize sikwamukele futhi mbukeli, sikhuluma ngesifo se-diabetes nekuthi kubaluleke ngani noma kanjani ukuthi bantu baye kuma-test ukubona ukuthi banaso lesifo noma cha, nekuthi singaya kanjani noma singanyangeka kanjani bodokotela. Kanti-ke lokunye lengakutshela kona mbukeli ukuthi tincingo tethu tivulekile la, ungasishayela ku-7146918 noma 7146919 noma uthumele SMS ngekuthi uthumele igama lelithi right ku 33726. You can also send us an email to consumer@sabc.co.za noma ku Facebook yethu iyilungelo noma i-tweet ku@iyilungelo. Kanti ngembi kokuthi sivakashele itolo siye sakhuluma ngendzaba yokuvakashela kubodokotela noma edibhedlela ukuthi uma ubuka live lakithi laseNingizimu Afrika uthola ukuthi kuletinye tindzawo tibhedlela noma ama-clinic akekho esimeni lesikahle. Kanti-ke dokotela uye washo ukuthi uma akhona lawo ma-clinic noma ama-mobile clinics afikile kumele nende isiqinisekiso sokuthi niyatestwa ngokuthi bathathe ingadi noma bathathe umchamo noma bajove emthanjeni ukuze bathathe leyo ngadi leyo bakutest. Kanti lokho akubithi kakhulu uma udla kahle uthi gcina u-exercise ungahlala uphilile. Kanti asithathe lo munye umbukeli wethu lapha ekhaya. Welcome to Yilungelo Lakho. Lady, welcome to Yilungelo Lakho.
Hello, kunjani?
Siyaphila lady.
Ngona diabetic type 2 ne?
Yes.
So I just want to know ukuthi sometimes even if ngidla kahle exercise and all that, then you sometimes you find ukuthi awulali ebusuku, like more stress sometimes due to umsebenzi or something, then you feel otherwise.
Okay.
What can you take?
Okay, all right. Okay. Lady, she's asking, she's diabetic 2, type 2, and at night she can't sleep. She's eating healthy, she's exercising, but she's having some sleepless nights. Then your advice?
Right, so she mentioned the word stress, all right? You see, diabetes is a type of disease that makes you look at your life and what you need to change to make things better. There's a couple of things she needs to look at. If she's not sleeping well, she needs to manage the stress levels, manage work, home environment, that sort of thing. You need to make sure that your sugar control is good. Are you effectively dieting? A lot of patients will say, I'm trying to eat properly, I'm trying to exercise, but what are you actually achieving? And there are targets for that. You need 150 minutes of cardiovascular exercise per week. You need to constantly be eating healthy. You need to monitor your HbA1c, which is what Graham mentioned, which is a reflection of your sugar control. If all those things are good and you're still not sleeping, you need to consult with a physician before something can be prescribed.
Okay, all right. Before we go to consultation, let's take Karabo. Karabo, welcome to our program.
Kunjani futhi?
Ngiyaphila Karabo.
Ngiyaphila. Bengicela ukubuza ukuthi ama-symptoms e-diabetes ne-HIV ayafana na?
Okay, thanks so much. We are going to that question as to ask. She's asking that sometimes many people confuse symptoms, signs or symptoms of diabetes with HIV. So she's asking, is that are they the same?
You can. I mean, that's a very complicated question, first of all, right? The diagnosis of HIV is made on specific blood tests, and you have the virus, and it's treated differently. Usually, HIV patients who are not diagnosed would be losing weight, are chronically ill. They have a lot of infections and that sort of thing. Whereas with type 2 diabetes, these patients generally put on weight and are very asymptomatic, okay? The overlap between HIV and diabetes is an important thing in South Africa, because those patients that are on ARVs and that sort of thing may have a slightly higher risk of diabetes. So HIV patients must be screened for diabetes as well. And as soon as it is detected, it must be treated as well.
Okay, all right. Let me come to you, Graham. You talked about eating healthy. People think that when you're talking eating healthy, you must have this dish of white meat and vegetables and fruit on the other side.
My experience has been that you can eat quite normally, providing your dietitian or your educator has guided you about how much carbohydrate you need, how much protein you need. You have to learn to not eat chocolates and sweets like perhaps you used to, but you can have small quantities of these luxuries as long as you don't overdo it.
And then the quantity of food that you take?
In my particular case, I've been trying to lose a lot of weight recently, and we can talk later on about how I've done that, but I've reduced my portion size substantially. I eat my meals off a side plate, so the plate looks full, but it's probably half of what I was having before. But because of the procedure I've undergone, which involves hypnotherapy, I have been able to get the full feeling halfway through a meal. So I eat a lot less, which has resulted in less insulin required by my body.
Okay, let me take another caller. Welcome to our program. Malefu?
Hello, Lindan. You know, I just want to find out, I'm diabetic, I'm type 2. and my sugar is controlled. It's never above 10. It's between 6 and 8. But I've got a problem of my feet. My feet are feeling hot and cold. So I need to know what causes that and what can I use to help me on that.
All right, thank you so much, Malif. I think if we are watching there, Ugram brought his shoe. Tell us about this shoe. I think it's linked to Malif's question.
Absolutely. I know that there are many symptoms that diabetics get. Eye disease the doctor has spoken about. I've had 2 cataract operations. Foot pain is something that is huge in many diabetics. Historically, there were a lot of amputations because of diabetes. These days, if you control your blood glucose, you won't need an operation. Before I was diagnosed with type 2 diabetes, I had pins and needles in my feet. And I went to a specialist and was told I have incurable nerve damage.
And then let's come to the shoe itself. How does it help one?
These shoes are specialized shoes that have implanted silver particles.
You can show us the shoe?
The shoe is a normal Croc shoe, but it's a diabetic special, which has implanted silver particles, and silver is great for healing all types of wounds. It has a toe cap to prevent the toes, because a lot of diabetics have toe damage through walking through fields or walking in business circumstances, so it has a special toe cap on it. It has a deep insert at the back, so your heel is protected, and they are especially designed for diabetic feet.
So where do you get them? Do you get it at any retail shop?
No, they're available through an exclusive distributor in South Africa, and perhaps the producer could put up the number later on the screen of where people can phone to get help. They are available from some stores. Certainly the pharmacy at the Diabetes Centre in Houghton sells a range of these, and there are many different types and styles that are available. They are really comfortable for diabetic feet with neuropathy.
And then in terms of cost, how much roughly?
I would think that they're probably around about 400, 500, 600 rand, depending on the style that you choose. They're not cheap. But you know, in South Africa, a lot of people still use the old rubber tire, the automobile tire that they cut up, and that makes an adequate sandal for those that cannot afford to purchase the real thing.
Okay, thanks so much, Graham. Let's take another caller. Dudu, welcome to Yilungelo Lakho. Siyaphila.
Siyaphila, nami ngine diabetes type 2 ne. Nginenkinga isisoma sigcwalelana umoya and then ngikhishwa ihloko right every time again.
Okay.
Ngabe yile shukela.
All right, ngicabanga ukuthi udawulalela ngidawubuta dokotela quickly. Dudu, she's suffering from constipation as well as a headache. Yeah.
Type 2 diabetes, if it's not well controlled, can affect the gastrointestinal system, something called diabetic gastroparesis, all right? Constipation and headache can be due to many other causes as well. Once again, I just want to reiterate something here and tie it up with this question.
Yeah, just briefly.
Briefly. So the nerve damage, the burning under the feet, the stomach complications, all of that, the most critical thing is good sugar control, prevention. All of the other things come in management and assisting with the symptoms in the long term, all right? If this patient is having headaches and constipation, she may have some diabetic complications. She should check her blood pressure. If she's not on blood pressure medication and it's high, she needs to be on it. So there's an assessment that needs to be made before you can just advise over the phone.
Okay, all right. Thanks so much, doctor. For now, let's take another commercial break. Please don't go away. Welcome back. Usabukelela wona hlelo Yilungelo Lakho. It's all right. Sisakata bukhoma la ku SABC 1 Mzansi for sure. Remember, you can take part in this show by calling us on 011-714-6919 noma 714-6918 noma uthumele igama lethi right nge-SMS ku 33726. Kanti ke sinawo ama Facebook messages ethu la lenginayo la ithi people from Lwazi Levi Lubisi uthi the people of South Africa must go to clinics, especially our youth, please, is begging you. And then omunye Brightest Charity uthi diabetes really affects quite a lot of people. It is painful knowing that if diabetes, people can somehow avoid it. And then another one, nice topic to the youth of South Africa. They are so scared to go to clinics to get tested. It better know about your health and do some exercises every day. That's Irene Kosi. People should eat healthy and exercise more often. if you are not overweight, are you at risk of being diagnosed with diabetes? That's not a doctor?
If you're not overweight, you can still get diabetes, and like I said, there are other risk factors, okay? So look at your family history and keep a close eye on your sugar. You know, an annual or two yearly checkup for your sugar is always a good idea.
Okay,
yeah.
All right. Let's take another caller. George, welcome to Yilungelo Lakho.
Yeah.
Yes, George. Sorry, George, your line is very bad. I think our producers have to call you again. Kuba mkhulu ngemtimba noma kukhuluphala. Ingabe mhlambe nibasita njani bantu labafana nalabo ngoba bayasho ukuthi sengikhulupele kakhulu mhlambe senginashukela. Ngikuphi laba ngakhona for assistance?
Into abalekile siyasifumana ihistory yomuntu nabo ukuthi intoni engaba inegalelo ekubeni umuntu akhuluphale. Ngenye ixesha indlela umuntu atya ngayo, ngenye ixesha indlela umuntu atya ngayo, umuntu nxa etya kakhulu, enye into uzafumana into yokuthi abantu abazilolongi aba-exercise, ngabantu abasoloko barelaxile, baqabela imoto, bahlala ezithivini ixesha lonke. Ngoku into esiyikhuthaza ukuthi abantu funeka bazilolonge, batye ngendlela efanelekileyo, bazilinganisele ukutya, batye kakuhle, bangatyi kakhulu. And then xa bafuna incedo ke esenteni yethu likhona incedo esenteni, sinabantu abangongcwepheshe engakumbi ke ekutheni na bangayiluza kanjani iweight, bangenza kanjani ukuthi bangaqhubeki ugaina.
Ngepa uma ubale Center for Diabetes and Endocrinology, ingabe mhlambe it's based here in Johannesburg kuphela, mhlambe it's countrywide?
Yeah, i-head office lapha eJohannesburg, but i-center yethu ine national distribution. Across the country, we have well over 300 branches.
And then uma ubuka mhlambe history yalesifo, uthola ukuthi labanye bathi we go to doctors bayosihlola, but uthola ukuthi lesifo lesi asibona. Is it possible ukuthi mhlambe this kind of a disease hides somewhere where you think you don't have it while it's somewhere in your system?
Yeah, into efuneka yaziwe kwakhona, abantu abaninzi bafuna ukulindela impawu ezo, and umuntu nxa nofuna uhlala alindela impawu ezo kungamthatha iminyaka e7 okanye 10 before impawu ziqhamuka. Kanti ke njengoba sitsho ke ukuthi ukuze umuntu akwazi uyazi ngexesha funeka kanye enyangeni ezi6 aye ekliniki, aye elaboratory okanye chemist, acele ukuthi bamenze i-fasting glucose. Njengoba doctor echile i-fasting glucose apho ukuthi umuntu ohleli ihora ezingaba 8 angakadli evuka nje aye abomtest uzaze ngaloo ndlela, otherwise ukulenda impawu ezo kuzamthatha ixesha.
Okay, doctor, the link between obesity and diabetes?
So there's a direct link between it. Type 2 diabetic patients tend to be obese, and obesity contributes towards the insulin resistance in the long term. The important thing about obesity and diabetes is the combination increases your cardiovascular risk, meaning that diabetes itself increases your risk of a heart attack, stroke, that sort of thing. And then obesity is an additional risk factor. And then obese people also tend to have higher blood pressure and bad cholesterol. So if you take all those risk factors together, you're putting yourself in a position for a high risk of having some sort of vascular event. You see, so that's the link between them. It's very important to treat every risk factor very aggressively in a diabetic patient.
Okay, let's now look at diabetes and complications. Where do you say now it's complicated?
All right, so I think the understanding is that diabetes is a silent disease. And the reason why we treat the sugar, just to re-emphasize, is to prevent the complications. And the complications are of two types, where the big vessels in the body are affected and you can get a heart attack or stroke. That's complication of diabetes. Then when the small vessels are affected, you can get eye disease, blindness, cataracts. You get the nerve problems that Graham was talking about under the feet. You can get gangrene due to blockage of vessels to the feet as well.
Okay.
But that's a big vessel disease. And then there's, of course, the kidney disease that goes with it as well.
Okay, let's take another caller. Koza, welcome to our program.
Yebo babanjani?
Siyaphila.
Siyaphila. La inkinga ukuthi this diabetic abantu why to be
Koza, Because iline yakho imbi kakhulu asikhona ukuthi sitholane nawe. Doctor, can you just proceed on that point? I think we'll take Khoza when maybe there's a space.
Yeah, so we were talking about complications. There's two big groups, big vessel disease and small vessel disease, and like we said, it can affect your feet, kidneys, your eyes, your nerves, etc. All right? So I think the important message on a show like this is to get it out there in the public, and Isaac was talking about it as well. That go and test your fasting sugar, understand that it's a quiet disease, and understand that to prevent those big outcomes, you need to be doing certain things long before you get those complications.
Okay, let's just go back a little bit to nutrition. Eating a lot of red meat, is it also contributing, or they should avoid red meat?
I've never heard of that, but there are many myths tied up with diabetes, and different people give different views. But I would say sensible eating, reducing your glucose intake is the basic.
Okay. All right. Babe Isaac, gafishane nje. Uma education noma mhlambe kufundisa abantu la ngaphandle niya kuphi nini banibona kanjani futhi?
Kaninzi abantu baza kuthi. Then ke thina sizabizwa ngezinye companies zis invite ukwazi so presenter. Iz companies zenza into okuthiwa yi social responsibility. Sizawusibiza ke thina sofundisa abantu. Ewe.
And then phela uma sibukile we've got urban, we've got rural areas. Labantu abalima emaphandleni ngabe niyabacabangela noma nicabangela mhlambe the only working class phela ukuthi ngibo bantu la lekumele sibanakekele.
Hayi nona abantu abasabacabangela. Ngokunathi into esicinga ukuthi siyacabanga into ba ama-services akho afumaneka emaklinikini khona ngiyazi kunezinye companies ezihamba ngebhasi around zimane zinakekela abantu zibatesta amehlo siyacabanga into kanje ama-services lawo atholakala ebantwini.
Okay, alright, asibambe lapho asiphinde sibuyele titolo nasibuya sawuchubeka nayo inkulumo yethu. Please stay tuned, don't go away. Welcome back. Usabukela lona hlelo Yilungelo Lakho, wena losesibhedlela, wena losekhaya, wena losesitolo, noma kuphi lapho ukhona nani banakethu nabo dzadewethu lenivalelwe amajele ahlukahlukene sikhuluma ngendzaba ye-diabetes. Uyithatha kanjani ingabe into le serious kuwena? On our closing note, traveling with diabetes, or you're traveling with diabetes, what is it that you can do as a patient?
When you're traveling with diabetes, I mean, it shouldn't stop you from traveling, really, all right? You just got to make sure that you're carrying your medication with you, all right? You adjust for time differences wherever you're landing with east-west travel. You want to take precautions on a flight because of the relative immobility on a flight, clotting risk, deep vein thrombosis, which are separate issues. So on a plane, you don't want to consume too much alcohol. You want to drink lots of water, stay hydrated, and you still want to continue monitoring your sugar. Yeah.
I'd like to stress one very important part. You need a letter from your doctor authorizing you to carry medication, and especially syringes. So always see your doctor before you leave on an overseas trip and get a letter of confirmation about what you're carrying.
And then what about those gogos, the old ladies and who are staying out there in the rural areas who do not have specialists? Where can they go?
I believe that they can get a letter from their local clinic. A certificate from their clinic or healthcare worker would be sufficient to get them through any customs or security checks at airports.
Okay. Emavakho ukugcina baba Isaac, ingabe mhlawumbe njengesive yini lekumele siqaphele kakhulu njengoba sikhuluma ngaso nasifo se-diabetes?
Into endinoyinyathelela into yokuba kubalulekile ukuthi umuntu ateste rhoqo. Kufuneka umuntu akwazi uba nomtshini ateste ushukela. Ngoba abantu abaninzi bacinga into yoba nxa baziva be-right bacinga into yoba ba-right. Kanti kubalulekile ukuthi funeka umuntu atshekishe. Umuntu aye kudokotela wakhe rhoqo.
Okay. All right. Your closing comment, Graham?
I believe that with the right health care, the early signs send you in for health care, that living with diabetes is really quite easily.
Okay. Dr. Sandeep?
I think just two things I want to mention in closing. One, there's a level of personal responsibility you have to take when you have type 2 diabetes, how you live, very important. Secondly, I think the social issues need to be addressed. Access to healthcare, management of healthcare. Government needs to come to the party. Trade and industry, sports and recreation, we need more parks. Food needs to be cheaper. Good food needs to be cheaper. Simple things like that. It's very complicated, but that's where attention needs to be paid. Yeah.
Yeah, because people are sometimes scared of the finances, you know, going to to hospitals and doctors.
Yeah, look, the public health sector provides services. What I'm saying is the standard and the level of those services at every level need to continuously be improved to allow access for patients to come and ask these questions and get the answers they're looking for.
And then online is possible?
No, no, there are websites. There are a lot of websites available, but the most prestige treatment, or the most common treatment, is where somebody has a good medical aid.
Okay.
Then they can go to places like the Centre for Diabetes and get all the care they need absolutely free of charge because the medical aid funds it.
Okay. Thank you so much, gentlemen, for coming to our show and enlighten the public about this silent killer. But before we go to our closing, we would like to say our thoughts are with the Matlala and Ngwepe family. Joanna Kwena Matlala passed on last Saturday after a long battle with diabetes. She was the daughter of President Bernard Ngwepe. We say rest in peace. Kanzi-ke ngelishwa ababukeli isikhathi sesiphelile nyalo kumele sibeke khona lapho senza kubuka anti vashtethu ngokusineta isikhathi sathu nokuthi nawe lapha ekhaya mbukeli usinikete isikhathi sakho ukuthi ubukele lo hlelo Yilungelo Lakho. Please join us again next Friday lapho khona siyabe siqhubeka nema-consumer topics of the week nga 1:30 kuya ku 2:30 Nzambama. Kanzi na ufuna kubukela imbinza yalo hlelo, please tune in to the same channel on Mondays from 9:30 to 10:30. Kindly email your thoughts about this program and possible topic suggestions to consumer@sabc.co.za. Kanzi inombolo yethu ye-fax 0117146420. Alternatively, catch us on Facebook or follow us on Twitter. From me, Jonathan Lungu, and the entire team, it's goodbye. Nisale kahle.
Elakho mnganwa, elakho mnganwa, awungelakho mnganwa, oma yakhe timpolompo, awungelakho mnganwa.